I think this is a fascinating question. And I'm so glad that you are bringing this up because when we think about the endocrine system and how that influences so much of it, the thyroid itself is going to be this kind of master regulator of metabolism and the nervous system. So when those thyroid hormones are out of balance, they're dysregulated, it really affects many organ systems, including that bladder and the pelvic floor. So the thyroid hormones itself influence the autonomic nervous system, and that is really what controls the bladder filling and emptying. Thyroid hormones also affect the smooth muscle function. So we see this in the detrusor muscle of that bladder wall. And then fluid balance and kidney functions are greatly heavily influenced by thyroid function, and then pelvic floor muscle tone as well, as that being a muscle too. So when you think about hypo and hyperthyroid, so right, hypo, I think about everything slowing down. So if the thyroid is controlling that autonomic nervous system, it's slowing down that autonomic nervous system. So what you're going to see is slowed nerve signaling, which means that you're going to have reduced muscle contractility of that bladder. So that can greatly impair bladder emptying. So people may feel like they're not emptying out their bladder as much, or they feel like they have to go, but then when they get there, they actually can't go because that bladder muscle isn't wanting to squeeze. But the opposite, when we think about hyperthyroidism, you're getting that increase. So you're turning up a little bit more of that volume, and that increased sympathetic nervous system is going to irritate that bladder more. So you're going to have more irritability, maybe more overactive bladder, more urgency to go, and even urge incontinence. What I also find fascinating is with hyperthyroidism, some studies have actually shown that you could have an increased risk of urinary tract infections with it and urinary incontinence. But we think that that has a little bit to do with, again, kind of that increased signaling dysfunction of the bladder emptying, and so leading to those sorts of symptoms. Yes. So when you are thinking about hypothyroid, you're going to see that more commonly with overflow incontinence. Again, just think about hypo, everything just slows down. So you aren't having as much contractility. So you're having incomplete bladder emptying. And when that bladder doesn't want to empty, you get this overflow phenomenon that's going to happen. And then we know that with hypothyroid, that people tend to be fatigued, maybe they're moving a little bit slower. Again, it's affecting all of the muscles of the body. So you actually see what's called functional incontinence that goes along with it too. So meaning that it takes you a little bit longer to get to the bathroom. So if you're feeling the urge to get there and it takes you longer, your body hasn't adjusted to that. So you may leak a little bit actually when you get there. You can also have difficulty starting your urinary stream. You may have intermittent urination. And again, this is also where you could have recurrent urinary tract infections, which can also cause a little bit of that overactive bladder. So there can be a little bit of overlap. For your hyperthyroid piece of it, so again, you're turning up that function. That's where a lot of urge incontinence, so that bladder muscle squeezing a little bit more frequently, that overactivity. And then even at nighttime, people will say that they're getting up a lot more frequently with that urge to go to the bathroom. I always like to approach it from a root cause perspective. So if we are really concerned that it's the thyroid that is impacting those bladder symptoms, we want to treat that thyroid and optimize thyroid treatment first. We can do some additional support for that urinary symptoms, but it's going to take a little bit of time for those those thyroid levels to balance out. So alongside with that, we want to make sure that we are screening for other types of bladder function, which could be, again, concerns with emptying, urgency, getting up at night to go to the bathroom, or even urinary tract infections. So we're not just thinking about leakage. We also want to optimize that bladder function by pelvic floor physical therapy. And if anybody knows me as a urology PA, that's one of my first things anytime somebody comes to me with a bladder concern is I'm talking to them about pelvic floor physical therapy. Because again, especially in hypothyroidism, right, those muscles, so not just the bladder, but the pelvic floor muscles are going to be underactive. And so coordination can be impaired too. So we want to be able to have some support there as that's going to help alleviate any of those urinary symptoms. And then other types of behavioral things that you could do could be timed voiding, or even try to do some bladder retraining. And that's going to help to regulate that signaling and help put back that optimization in those bladder signaling, especially again in that hypothyroid. And then there can be some contributing factors. So sometimes we're seeing more thyroid changes in our perimenopausal and menopausal individuals. So using some local hormone therapy like vaginal estrogen can be really helpful. I'm always a big proponent of treating constipation. We see that too with hypothyroid, right? Everything's slowing down. So constipation is another one that we can see. And then that's going to put added pressure in the pelvis onto that bladder. And then optimizing hydration. It can feel a little counterintuitive to be increasing your fluid intake, but it can actually help to support that bladder function. And then we want to reduce the bladder irritants also. And then again, when we think about the thyroid piece of it, you have to treat the whole person. So, they could be tired. There may be some depression, some sleep interruption that is occurring. So it's not all just about treating the bladder or that thyroid. We really want to optimize that whole person care so that they are feeling supported from all aspects. Oh my goodness. So many individuals. And I'm going to talk about our female identified individuals first, because there is this misconception that, oh, because I'm a woman or I've had babies, that urinary incontinence or urinary leakage is just par for the course. And that is not the case. Just because something is common does not necessarily mean that it is normal. And there are a lot of treatable things that we can do to help to support that patient. So anytime somebody is having new or worsening bladder symptoms, you want to bring that up to your provider. If they are interfering with sleep, exercise, intimacy, work, or other activities, you don't want it to impair your life, so bring it up. If you feel like you're not emptying out your bladder often, or you're feeling like you're having recurrent urinary tract infections, or you have had confirmed recurrent urinary tract infections, that's something you want to do too. If you find that you are changing your maybe incontinence pads a little bit more frequently, that is something to bring up too. And then if those symptoms appeared after a thyroid diagnosis or even with a medication change, those are the things that you want to be able to bring up.